All right. Hi, my name is Jamel, and I am here to do my presentation for crisis management. I am a student in Herzing University, and my class is NU 675, and my instructor is Battle Weary. I have a PowerPoint presentation that I'm just going to go off of, so if you see me look to the side, please pay no mind. And we have 10 minutes to do a video. Both will be 5 minutes. But I will be discussing two patients. My first patient is a 45-year-old male who has been married for 15 years. He has 2 children with his wife. He has a history of major depressive disorder and an addiction to pornography, which he has dealt with therapy. He has an addiction. The addiction had caused some issues in their marriage for the past 5 years, but he's worked through it and gotten help. Things have been going well in his marriage, and he denies looking at any kind of porn or any kind of graphic sexual things in that sort. For his major depressive symptoms, they started in his early 20s. He has been managing that well with a low dose of Celexa, 20 milligrams daily. He comes in today visibly upset, unfortunately, and he has reported that he is having suicidal ideations. He reported that his wife has been cheating on him for about 2 years, and he came home from work to find his wife and his kids gone, with a detailed note of the infidelity that and stating that she took his children to live with the man that she has been seeing. She also filed for divorce. He states he had no idea, and now he had his own problems for the last 2 years, and he said that he feels a little stupid. He was so bothered in improving himself that he did not notice the issues that were in his marriage. And right now he is unable to work because he says he has too much stress. He does state that his children are his world. But what he is coming in here for today is he has suicide ideations, homicidal ideations, as he replies. He has been drinking a lot, about 6 packs a day, a night, and he plans to shoot himself. He does have access to firearm, and he does plan to act on it, but the only thing that's holding him back is that his love for his kids. But he doesn't know if he'll ever see them again or talk to them again, and he doesn't know what the next steps are. So what we're here to do is to treat him. Let me go on the top page. Okay, for his first patient, we've already talked about, and our immediate concerns are goals: guarantee patient safety, suicide prevention, complete a risk assessment, and assess if he needs to be hospitalized, which might possibly, if he has a plan to, if he has a plan, he has firearm and access to it, and he does vocalize his plan to go through it. But the only thing holding him back is the things for his children, and to remain on the Celexa. After completing the suicide evaluations, his ideations, how frequently are those thoughts, his intent, is he going to act on them, specify the plans, and his specific plan is to shoot himself. Does he has access to for his means? Yes, he does. Does he have a history of previous attempts? He doesn't state that he has a previous attempts of suicide, but he does have a history of major depressive disorder. He's also most likely to commit things under the influence of alcohol and medications in his system. The protective factors, which are very slim, and past his psychiatric history because of his MDD. His scale for hospitalization is very high, so the things that put him in that risk factor are that he is a male, he's middle age, he is divorced, children have moved away, he feels hopeless, he is drinking, he has suicidal plans, he has access to firearm, and he has occupational problems and hazards. The next one is protective factors. While there are a few things the patient has concerns, he's losing hope. He's had therapy before and it has worked. So he can be treated and talked to and it be effective. He is on a dose for medication for Celexa 20 milligrams and it's been effective. So, and he has support from his children because he loves them so much that holds him back. So that is a huge factor in this thing and assessing him. Our clinical decision, does he meet the criteria for hospitalization? Yes, he actually does. Due to his active suicidal ideations, specific plans with a firearm, the amount of alcohol use, his hopelessness, unable to contact safety, and functional. He's not working, he's feeling hopeless, he's kind of isolating himself and letting himself fall into a deeper depression. So he is in a risk he's a perfect candidate to be hospitalized. As that was the clinical decision, our immediate response is do not allow the patient to leave the office. We are going to leave him under constant observation. We're going to call emergency services, transport the patient to emergency department, initiate an involuntary eval, even if he refuses, just because of his active verbal suicidal ideation. We're going to try to remove all access to firearms from him for his safety. Patient safety is always huge. Contact the wife when it's appropriate. Treatment options, we are hospitalizing him. We're doing a complete psychiatric evaluation, medication reassessment. We're going to put him on alcohol withdrawal protocol if needed, depending how he handled not having alcohol every night. He was having 6 packs a night, so we're going to start with cognitive behavioral therapy, provide family therapy, and reinforce safety plans, and then also talk to him about discharge instructions of what to do after. Okay, the legal portions. Legal and ethical issues. Ethical principles, patient safety is the most important thing, and confidentiality is huge situation in this. So if we are going to contact his ex-wife, we do have to keep his privacy. Some of the key points that we do have to cover, that we are going to go over that for how we decided to treat him, is psychiatric emergency, hospitalization at this moment, remove patient's access to firearm, treat for alcohol use, and provide comprehensive psychiatric stabilization, provide intensive outpatient follow-up upon discharge. So that is the treatment plan for patient number 1. Thank you for listening on how we handle that situation, and this will be my next video will be on patient number 2. Thank you. I'll be uploading this shortly.